Hi, everyone. I'm Leslyn Keith, President of the Board for the Lipedema Project, and I'm here with my friend and colleague, Gail Straker. Hi, Gail.
Hi, Leslyn. It's good to be here.
And we're also here with Dr. Carlos Zumarraga, one of our coaches, consultants with our Global Coaching Collaborative. He is also going to be speaking at the symposium coming up April 29-30, the Ketogenic Revolution for Lipedema and Lymphedema. So we're pleased here also to be talking to Carlos. How are you?
I'm very good, thank you. Can you hear me?
Yes, we can. A little bit of a connection problem here, but we're happy to be here with you today.
I'm very happy to be here also to talk about the next symposium. So thank you very much.
Excellent, excellent. Thank you. And you're going to be talking about the gut and leaky gut, I guess, and autoimmune disorders and ketogenic nutrition, correct?
Yes. We are going to cover autoimmune diseases and the ketogenic diet. We are going to review also a little bit of inflammation and a little bit of the connection of the autoimmune inflammatory conditions and also the lipedema inflammation as well.
Oh, great. Because we've been talking a lot about lipedema inflammation as it relates to pain. Are you going to be touching on pain at all in your talk?
Not about pain. There are some conditions that improve when you decrease inflammation with the ketogenic diet and you decrease autoimmunity. You see a decrease in pain in the patients, but this result of being in an anti-inflammatory state.
So it sounds like that the pain symptom might just resolve or reduce as a side effect of dealing with the inflammatory state and gut problems. Is that what you're saying?
Yes, that's what we are going to review. Yeah, we are going to focus on leaky gut syndrome. That is a condition that is associated with diet. When we have leaky gut syndrome, we can develop inflammation and an immune response in the gut that may cross-react with other structures in the system, and then we can develop autoimmune disease. And this is what we're going to review: how to interrupt the leaky gut and to decrease the inflammation and the autoimmunity in these patients.
Excellent, excellent. And you are working with our Global Coaching Collaborative and are going to participate in the Coach's Corner in the symposium. Gail, can you talk a little bit about what you and Carlos and the other coaches are going to be doing with that?
Sure. So it's always my pleasure to work with Dr. Carlos. We've been working together since, oh my gosh, the last symposium, actually, our symposium in October. And one of the things that we realized when the coaches were discussing things on how they could be involved in the symposium, we realized that the attendees would love to be able to talk one-on-one with our coaches. And so at the end of each day's scheduled symposium, we are going to hold 45 minutes to an hour open for all the attendees to come and visit with our coaches, not necessarily one-on-one, might be small groups, but you'll be able to reach out and actually ask our coaches questions. We'll be in a meeting, and you'll be able to come and discuss things with our coaches. That will happen at the end of Friday night and at the end of Saturday night. But it's also going to happen before the symposium on Saturday and on Sunday. And we're very excited. Dr. Carlos is one of the 9 coaches that are going to be there. I'm going to be there as a coach, and we have several others that are going to, they can discuss keto with you. We have a couple of coaches that are CLTs, certified lymphatic therapists. We have nutritionists. Dr. Carlos runs his own clinic, his own keto clinic. So we do have experts. We have Brian Hayward, who's going to talk about CBD. So we do have experts there for you to reach out to, talk to, and get your questions answered one-on-one. It's not going to be like a webinar where you have to type your questions in. You're actually going to get to go into a Zoom room with our coaches and discuss things with them. It's very exciting.
Mm-hmm. Yeah, and Dr. Carlos, you are actually a mentor. I mean, you were mentored by Dr. Eric Westman. So you have your clinic in Mexico, but you came up to the U.S. and were with Dr. Westman. Tell us about that experience.
Yes, it was in 2019. I went to Duke University, where the clinic is at. The clinic is very important for us because it's a research clinic that developed the evidence to bring the ketogenic diets to the clinical practice. So it was an amazing experience to be able to see patients and to learn from the doctors, from Dr. Westman, Dr. Yancey. And this model of the clinic is the one that we use in Mexico for our patients. Mainly, we treat patients suffering from metabolic diseases like diabetes and obesity and fatty liver disease that are associated with hyperinsulinemia. And these diseases respond excellent to the carbohydrate restriction, and the patients do very well. There are other applications for the ketogenic diet in neurology, in oncology, and also in inflammation, autoimmune diseases. The work that we have done with autoimmune diseases here in Mexico, it's really an extension of the metabolic treatment, because what we do is we treat patients with the metabolic disease, with diabetes or obesity, and they have as well autoimmune diseases. So we observe and we assess the conditions of these patients, and we see the conditions improve, even as is a secondary application of the ketogenic diet for us. But the results have been very well. So this is the reason why we are developing this presentation for the lipedema community, because we have patients with lipedema and other diseases as well. So we have some experience with the autoimmune diseases and the response that they have with the ketogenic diet, and it's a very good response.
Yeah, and in your work with those patients that have multiple conditions, have you found that you were able to reduce their medications, maybe the number of medications they're on or the dosage? Is that difficult to manage as they're coming off of medications?
Well, there is difference between, the immunosuppressive medications for the autoimmune conditions and the metabolic treatments or the anti-diabetic medications for diabetes. It's different because we have different approach to the diseases. But in diabetes, we can reduce medications very fast. The ketogenic diet is very effective, and we can even stop all the medications in patients that are suffering from diabetes type 2 because the lifestyle treatment is really remission treatment. For patients that are suffering from autoimmune diseases, they are usually taking immunosuppressive medications like prednisone or methotrexate or mycophenolate. All of these diseases, all of these medications can be reduced. Sometimes we reduce the medication a little bit because the condition is getting better. And sometimes what we do is we make the treatment more effective because the patients continue with their medications, but the condition is not improving. And when we add the ketogenic diet to the treatment, we can see that the disease starts to correct and to respond to the treatment. So it's a different way of managing the pharmacology in the patients.
Yeah, I mean, do you sometimes feel that you are, you're having to chart, territory that no one's gone before? Because usually doctors are giving more medications, right? And you're having to prescribe medications for the work you're doing. You're having to take people off of it.
Yes, yeah, that's it's a beautiful thing for the clinical treatment. It's amazing to be able to evidence-based, in an evidence-based way, to reduce medications because we know that the patient is going to get better, and we can calculate the reduction of the dose in diabetes, for example. And for the other conditions, when we use the ketogenic diet as a complementary therapy, we usually keep the protocol for them, the therapeutic protocol that they have, and we just add the ketogenic diet because there is no interaction between the ketogenic diet and the medications. So later on, we can try to reduce, or with collaboration with the other team of doctors, we try to reduce the medication for the immunosuppression. So it's very good to see that the patients improve, that the condition improve, not only clinically, but also in the laboratories. We can see that the inflammation decrease, that the glucose decrease, that the insulin decrease, that the hemoglobin A1C decrease, that the C-reactive protein decrease. And so we are seeing the clinical aspect and also the pharmacology and also the laboratories, the objective data that we have with the patients is telling us that we can reduce the medication. So this is the way that we do it.
Yeah, very, very exciting. And Gail, you're going to be presenting at the symposium as well.
I am.
Can you tell us a little bit about that?
Sure. So for me, I don't have a medical degree by any means, but I do have experience, and in the ketogenic way of eating and being living a ketogenic lifestyle. Really, that's what it is for me. And I've been running in ketosis, becoming more and more flexible with my ketones. I suppose I slide in and out of ketosis easily. And one of my biggest tools in my toolbox is intermittent fasting. And so I've learned in a very I wouldn't say I'm a slow learner, but it took me quite a while to get all of my fasting muscles organized, and I go through how you can really do this slowly, step by step. I explain how I did it, starting with a pencil and a piece of paper and writing down every time I eat. And that's how I started, and I do extended fasting now and everything. But I explain the benefits that I received and how I learned how to fast. So Okay, I lost your sound, Leslyn.
Sorry, I forgot that I muted. I was just going to point out that it says next to your name, community manager, but you are also the coaching director for our global coaching collaborative, of which Dr. Carlos is part of. And we really want to encourage people to register for the symposium and join us there. It is all virtual. We're getting people from around the world to present and to attend at this symposium. You're going to have talks like Gail talking about slowing down to fast, and Dr. Carlos talking about autoimmunity and leaky gut as it relates to lipedema. Lots of fantastic presentations, and it's all recorded. So if you can't be there in person, don't worry, you will be able to watch the replay later. It's going to be really an action-packed event starting on Friday, April 29, and going through all day on Saturday, the 30th, and then a workshop, post-symposium workshop on the carnivore diet will be there. We'll be having that on Sunday, May 1st. So we're really excited to have both of you as part of this symposium. I should say also that Gail will also be there doing, I think we're calling it this time, movement with Gail, because you can't be sitting in front of your computer for the whole length of the symposium. You got to get up and move once in a while. And so Gail will be helping us with that as well.
I get roped into this now. It seems like every time, but it is true, Leslyn and Carlos. We all know how as we sit down and we start feeling sedentary, that we start, our bodies just start reacting. We quit thinking clearly. Our legs get heavy. We swell up. And so we've got to keep moving. We've got to keep breathing. And I'm always honored when Leslyn asked me if I would do the movement portion where I get up and we do some stretches during some of our breaks. And I'm honored to be able to do that.
Dr. Carlos, you are so incredibly involved in everything that we're doing with lipedema. I just wonder, how do you have any time for your family? It seems like you're always working.
There is always time for family. We find a way. I have two babies. One is 5, and the other one is 4. So we are always with them, and we try to accommodate the clinic to them more than them to the clinic, because they are always the priority.
Yes, yeah, that's good. That's good. So Gail and I are both happy to know that you're balancing and making sure that you have plenty of time for your family, because it does seem like you're always working to us. And we are so pleased to have you not only as part of the coaching collaborative, but also as part of this symposium. So thank you both for joining me here today to talk about the symposium.
Thank you very much. It's a pleasure, and looking forward to being the symposium, and also we are going to be there also for questions and answers in between the presentations. So if the patients have some questions about ketogenic diet and lipedema and all of these, lymphedema and other metabolic conditions, we will be there to answer the questions. So thank you very much for the invitation to do this presentation.
Great, wonderful. Thank you so much. Bye-bye, everybody.